And today I see Rachel here in the house, and I just want to say hi to Rachel. Today our very special partner, sponsor, guest is Rachel from Rachel's Remedy, and we are going to partner with them today to bring you this great breastfeeding information, and we're going to get a prize too. So Rachel's going to give us a prize. Yeah, that's Rachel there. She's saying hi to everybody. Hi, Rachel. You like my background? It's pretty background, right? Yeah. Joe moved the plants over so that I felt like I was outdoors. We bring the outdoors in, but it's interesting. You could see behind me, there's no leaves on the trees outside, only on the inside here. So it's nice and warm in the house. Yay, prizes. Yes, yay, prizes. So how's the stream? Are you guys good? Can you give me some hearts if everything's okay and you can see fine? Because I'm doing it from my computer. I'm actually going to pull up my phone right now to check out, because I can only see hearts on my phone, and you know how much I love to see all your hearts. We're gonna do, we're gonna make sure that we do what we always do, which is I'm gonna read someone's question, and then I'm going to give an answer, and then we always give hearts for questions and answers. So anybody who's new, that is our thing. We like to give lots of love for anybody who takes the time to post their question, and then for me to answer your question, because you know how much I love hearts. So let's see some hearts go across the screen, because I'm looking here on my phone. It doesn't show it to me on my computer. And it's a little bit of a delay, and I want to make sure too that the stream is coming through okay. There we go. Awesome. I don't know what's wrong with mine. It's not coming through on here. Isn't that funny?
Click on it.
Isn't that funny? Oh, you know what it is? I didn't click on it. There we go.
There.
All right, now we got it. Awesome. Okay. Perfection. Perfection. All right. So again, our special guest sponsor today is Rachel's Remedy, and Rachel is in the house. And Rachel's Remedy makes an amazing product. And I recently spoke with Rachel. We had a long conversation, and we could have talked all day. She was a breastfeeding mom, and she created these amazing heat packs. They're hot and cold packs, and what they do is you can heat them up and you can cool them. But the difference between these packs and other packs is that she's applying moist heat, which means that you can make this little cover moist, and then you attach it to here, and then this can go inside your bra. And we're going to talk about this a little bit more in a little while. And these are Rachel's Remedies heat and cold packs, okay, and why they're important, and we'll talk about that when we answer some of these questions. But then these can go inside your bra because they're waterproof. Genius, okay, a genius product. I loved it. I was like, okay, once we talked about it, I'm like, this is amazing. There really isn't anything like this. So great job, Rachel, great job. Excited about being able to show it to everybody. How many of you guys are new here? How many guys it's your first time with me today? I know that we have some new people, because we have a lot of new people joining the page. So if you're new, say hello so everybody can welcome you. And yes, and you're posting your questions, more questions here. Yes. Okay, so let's get started because we have a lot to say. This is your second time. Okay, your first time. Excellent. Yay, welcome, welcome, Shari, Amanda. Yay, Giovanna. Look at this. Look at all the new people. Let's welcome everybody. Lots of hearts. First timers. Yay, love to see it. Love to see it. Excellent, excellent. Okay. So let's go ahead and answer some of the questions that definitely came in here, because there's a lot to go through, and I like to get to as many as possible. Some of you guys wrote like a book, okay, and I know there's a lot of details, and so I may have to skip over some of the details just to get to the heart of the question. So if I skip over some of your details, trust that I have gotten to the meat of the question and that I will answer it for you, all right? So the first question that we're going to answer came in from, let's see, where am I here? Okay, this question came in from Megan, okay? Megan has a 3-week, and like I said, I'm going to paraphrase a little bit. Megan has a 3-week-old little boy, okay? The baby was born 36 weeks, so a little bit early, and she had kind of a traumatic delivery. She had a stomach virus, and so she was vomiting so hard she broke her water. Poor thing, okay? I can't even imagine. So the baby did okay, but the baby did have some blood sugar issues in the beginning. She had a fever and needed to be supplemented right in the beginning, but they supplemented with donor milk from a bottle. The baby was also a little jaundiced the first 8 days of life, so now here we are 3 weeks out, and he's still so sleepy. Okay, so this is her main question here, is that the baby's very sleepy. The baby's 3 weeks old. They have to undress him every time he eats because he falls asleep, and he won't effectively nurse, but maybe one time a day, if that. I try to nurse him for the first 15 minutes of every feeding, but he falls asleep and won't do anything or gets frustrated and won't suck. Sometimes he will suck twice and then pull off. Weighed feedings at the hospital show he isn't transferring anything for me, but my supply is solid. I've tried all the tricks that I know from nursing my daughter, which she nursed for 16 months, but none work consistently with him. She's frustrated and she has some postpartum depression. Okay, so mainly what I want to say to you, Megan, is you need to stay calm here because the baby was born 36 weeks. That means that if the baby's 3 weeks old right now, the baby's still not even at his due date. He's still not fully full term, okay? And preterm babies are going to be extra sleepy. So first things first is that that's actually pretty expected and pretty normal that he is on the sleepy side. That being said, it can make it really difficult to try to keep him awake for nursing, and I know how difficult that can be. And you need to be effectively removing your milk so that you can keep your supply up and that he's being fed so that he can grow and gain weight. A couple of things that I would recommend to you. One is to really get a good idea of, you said you did some weighed feedings. I don't know if you're supplementing with a bottle. It seems like you didn't say that here, but I'm assuming that you're pumping and feeding a bottle when you're not getting a good feeding. When the baby continues to get bottles, what's going to happen is two things. The baby may get more lazy at sucking at the breast because it is harder work to suck on the breast than to suck on the bottle. And the other thing too is that sometimes you will feed more milk than what the baby actually would need or eat at the breast if they were exclusively nursing. When you feed that extra milk with the bottle, the baby will be more sleepy. And so it's kind of this vicious circle where the baby's sleepy, so you give the bottle, which makes the baby more sleepy. And so I would really pay attention to how much the baby's eating. Make sure that you're doing paced feedings. And if you don't know what I'm talking about, Google paced feedings, and we'll actually talk about paced feedings at another time, but it's about slowing down the feeding, about letting the baby take control of the feeding when you're feeding a bottle. And the other thought I had when I was reading your question was two more things. One is that maybe it's a better idea for you to use a supplemental feeding system, and that's where you can take your own pumped milk or formula. If you were feeding formula, you're not, but in a situation where somebody has a low milk supply and they're actually feeding formula, but for you're pumped milk into a supplemental nursing system and feed the baby that way. It's a little tube that you take the milk, that it goes through the tube, it gets taped to your nipple, and the baby's feeding at the breast. This way we eliminate the bottle feedings. The baby's still getting breast milk, starts to learn better how to feed at the breast. And remember, when the baby's feeding at the breast with a supplemental nursing system, I can't talk today, supplemental nursing system, they're actually draining the breast while they're getting the flow. So that may be a good thing for you. You definitely need to be working with a lactation consultant to do that. I would recommend that because you want to get the baby back to breastfeeding as fast as possible and off the bottle if you can. Also off pumping. Yes.
Kate's friend, and she's been commenting to answer your question.
Oh, okay. That's your friend, Kate? Okay, awesome. Yeah.
On Amazon.
She bought, what, a supplemental nursing system? Excellent. Did you buy that for her, Kate? How do I know? You and I are like, okay. All right, great. So that's great. The only thing I would recommend, though, Kate, is to make sure that Megan is working with a lactation consultant using the supplemental nurser if possible, okay? I know they sell them on Amazon, but you really do want to get help, okay? Is that called SNS? Yes. SNS is a supplemental nursing system. She did it on her own. Okay, listen, try your best, but you may want to get help too, especially with a preemie like this, okay? We want to make sure that the baby is transferring milk. You want to see, and the point with a supplemental nursing system is to slowly start to be able to decrease the amount of the milk going through the nursing system, so the baby is draining the breast, and eventually get the baby off that system altogether. The way that you do that is you need to be working with somebody to help you time that. Okay, so yeah, I think that's a great suggestion. The last thing too, and this refers to actually Rachel's remedy. I love the name because it really is Rachel's remedy. Rachel's here in the chat room with us, and this is her remedy. And these warm, moist packs, what they do is they can help to encourage a better letdown, a faster letdown. It helps to encourage oxytocin release so that the milk actually flows. It dilates the blood vessels in the breast so that the milk expresses easier. And one of the reasons that babies can become very sleepy or lazy at the breast, we don't really want to call these, but it's kind of lazy, is that the milk may not be flowing fast enough, especially if the baby's been used to taking a bottle. So warm, moist heat applied to the breast before and during the feeding or pumping, okay, for any of you guys who are exclusively pumping or back to work and pumping, the moist heat can help to encourage a faster letdown, more milk expression, and overall a better feeding, which then will lead to better milk production because you're expressing more milk. The more milk you express, the more milk you will make. Okay, so that's a really, this plus the nursing system, I think, is a really good option for you. And how lucky are you that you have Kate as your friend, who I know will be there, right there for you. Okay, so very happy. Hi, Megan. I don't know if you just missed everything I just said to you, but you can go back and watch the replay and Kate will fill you in, okay? Excellent. Okay, so hearts for Megan, hearts for Kate, hearts for Shari, hearts for Rachel, and everybody involved in that long answer, because you know I don't do anything simply, and because these require more than a simple answer, Yes, okay. You are lucky. Kate's wonderful. Okay. So let's move on to the next. Oh, look at all those beautiful hearts. I love it. You know what? It excites me. I don't know. It's like a thing, you know, I can feel, it's so interesting because watching the hearts, I feel the love, and love is like the thing that just keeps this all flowing, right? Isn't that the truth? Like even our breastfeeding, isn't it just liquid love? I mean, that's what we're doing, is we're talking about giving love to our child. And so as I see these hearts flying by, I just feel really connected with each of you. So thank you for that. I want to tell you a little bit for a moment before we move on to the next question. I want to share with you why today is a special day for me. Today is January 18th, and today is my first daughter's 15th birthday. What that means is today is her birthday, and she's 15, and it's also our anniversary, mine and my daughter's, and the anniversary of me becoming a mom for the first time. And I woke up very early this morning, and in the dark, I laid there, and I think it was like, I don't know, 5 o'clock in the morning, and something woke me up, and I just laid there, and I had this moment and a thought of where was I 15 years ago at that moment. And I remembered I was sitting in my living room on my couch in labor, and my doula had just arrived, and I just had this beautiful memory of Mary sitting with me, Joe there, and just a a beautiful memory of that first day. You know, for so many of you guys, you're new here. We've just only recently met. You may not know all of my background, but I had been involved in taking care of moms and babies and dads for many, many years before I had my first child. I was a labor and delivery nurse for 7 years. I was a midwife for almost 10 years. But before I had my child, I, had delivered over like almost 600 babies before I even had my first baby. And so, of course, conceptually, I understood, or I thought I understood what it was to be in labor. I knew all the mechanics of it. I had been with thousands of women through their births and their labors and through their pregnancies. But there's nothing quite like doing it yourself. And so I have some really beautiful feelings and memories today, and the biggest blessing of my life, which is having become a mom. So I come to you here with these Q&As, with these live streams, with all this great information, not necessarily from my own experience, because I have to say that I did struggle along with a lot of you guys. And sometimes I read over the questions and I'm like, wow, I actually dealt with a lot of this stuff. You'd be surprised that I didn't know very much, even though I was delivering babies, when it came to breastfeeding. And it was actually the thing that compelled me to move forward and become an international board certified lactation consultant and start working with moms through and helping in their breastfeeding experience because of my own struggles with it. I was shocked. But today I'm celebrating, and I'm wishing my daughter, my Jade, my beautiful Jade, who is a young lady today, 15. It goes that fast, so enjoy every single moment, okay? And because you don't always enjoy every single moment of 15. I said to Joe this morning, I loved 15 hours. I loved 15 weeks. I loved 15 months, but 15 years, not every moment. Not every moment do I love, but I know that's just being 15. Not any worse than I was at 15. Let's put it that way. Don't tell her. So, yes, being the mom is the best feeling in the whole world. I agree with you, Nikki. I agree with you, Nikki. So, yes, excellent. Okay, so this is why it's a special day for me. And so I'm just really happy that we're getting to do this live stream on this wonderful day of her birthday. That being said, let's move on to the next question, or we'll never get through all of these. Yay. Yeah, okay, I'll tell her happy birthday from all of you. Yeah. Okay, fantastic. And I have 2 daughters, by the way. Jade is 15 and Talia is 12 and a half. She'll be 13 in May. So I'm going to have 2 teenagers this year. 2 teenagers. Yeah, never thought that was going to happen, but here we are. Okay, next question. Let's see. This question came in from Susan. Oh, Susan Robertson. Hi, Susan. We are at 20 months and still nurse pretty heavy, especially at night. He is the first child I've nursed past 6 months. Great job. And I have not a clue on how to start weaning him. He never did take a bottle. He wound up nursing to sleep at nap and bed. I don't know if we should start with night weaning, daytime, or what. Any advice would be greatly appreciated. So, it's a hard time to wean. I have to say that 20 months, what's wrong with me? 20 months is not the easiest time. I find that sometimes earlier is easier, although I'm not encouraging you to do that. And then sometimes when you get beyond like the 15, 16 month, you're kind of in it for the next like 24 months, 2 years. It's hard because you can't really reason with them that well at 20 months or 18 months. But if I had to give you a recommendation of like what to start with, it wouldn't be the nighttime ones, okay? And it wouldn't be the bedtime ones, and it wouldn't be the first ones in the morning, that early morning feedings. What I would recommend is to start with during the day. Child's going to be much more active, child's eating solid foods, child's very distracted, and just start weaning off those daytime feedings first. Joe, I need a tissue. So weaning off those daytime feedings are going to be a lot better than trying to do the middle of the night at first, or doing the nighttime feedings like right before bed. And you obviously don't want to do them all at the same time. You might even want to start like going out at certain times of the day, spending a little more time outside the house where the child has more distraction, maybe some play groups, things like that, or play dates, something to distract them so that they're not as interested in nursing. And the reason I say that is, first of all, start to wean down those feedings, because what happens when you wean, and this is something that a lot of moms don't realize, is as you start to eliminate feedings, what happens is the sodium or the salt content of your milk starts to increase, okay? So as the salt increases in your milk, the milk doesn't taste the same, okay? And so you can start to wean out certain times of the day, and the milk starts to taste differently, the baby will start taking less, and your milk supply at that time of day will start to decrease, so there's not as much of a reward even if they want to nurse. So I would say daytime feedings, and then you'll start working on the night, okay? But great job, Susan. I mean, how amazing. You got to 20 months and only 6 with the last one. So yeah, really proud of you. Really proud of you. Susan's been with me for a long time here, for a long time. So yay. Okay, so hearts for Susan, and lots of love and luck in this weaning process, which is not always an easy one. Not always an easy one. Lots of hearts. Here we go. Okay, yay. I'm looking on my phone here because I can see the hearts. Yay, I love seeing them. Okay, good. Yes, being a mom is magical. Take a sip. Just saying relax and take a sip. Okay. This is not alcohol. On my Saturday night streams, I tend to drink my drinks out of wine glasses because it makes me feel happy to drink out of the wine glasses, even though it is not alcohol that I'm drinking. Today, this daytime, we won't drink out of a wine glass. Besides the fact, if I was to drink wine and do any of these Q&As, it would be a total disaster, okay? I personally, I cannot do that. Way too much information, and I get just silly and stupid. So we save that for after, not during. All right. Oh, yes. Okay, so let's move on. More questions here. You know, I want to answer a question that came in early on, and this came from Rachel. Not the same Rachel who makes Rachel's Remedy, but it was another Rachel who said that she's constantly getting plugged ducts. And that even while she was writing it, she was sitting there and she had ice on the clog. It's been a real problem for her while nursing both of her babies. She tried diet changes, drinking more water, switching nursing bras to very supportive non-underwire option, which is important. And we talked about that on Saturday, and how underwire can be a big contributor to plug ducts, okay? Her latch has been evaluated. She's done block feeding, chiropractic, hand expression. Seems like she went through the whole list here, and still struggling with block ducts, okay, or clogged ducts, plug ducts. There's many different ways to say it. It all means the same thing. It means that milk has become blocked in one area, and it's plugging up the duct, and it's preventing milk from behind that from expressing out of the breast. This is a problem because, one, it's going to cause you pain. Two, it's going to prevent milk from flowing out, which then can lead to a decreased milk supply or a drying up of the breast tissue in that area that's not being expressed. And three, can lead to an inflammation of the breast tissue around that area, and also into a mastitis, which can make you very sick. So it needs to be addressed, and for people who do have recurrent plug ducts, it is a real issue, okay? One of the things that you can start to look at is, and it looks like you have, is your bras, okay? And I'm gonna just repeat that for other people who may be struggling with the same thing. Any kind of compression onto the breast tissue is going to can cause plugs. Now, underwires especially have that effect because the wire is hard and it can be digging into the breast tissue even if fit properly, because between feedings your breasts are changing size, and so that wire can dig into the breast tissue and cause a plug to occur. Now, that doesn't only happen with wired bras. It can be improperly fit bras, so bras that are too constrictive or tight. Even if there's no wire, if the bra's not fitting you properly, and I see it all the time, like bras that are cutting, cutting you right here, so that you're actually compressing breast tissue, not with a wire, but with the bra itself, can cause a plugged duct. Or not getting a nursing bra, and I've seen this over and over again, and I bet you some of you guys do this, okay, where you actually lift the bra, okay, over your breast to nurse. So these are non-nursing bras that are being lifted over the breast. Now, what's happening to that band when you lift that bra over your breast? You're compressing the breast tissue. Okay, that means that there's milk stasis behind that band that's compressing. So if you're going to use a non-nursing bra, my suggestion is do not lift over the breast. Either pull down, okay, if you can, pull down, or take the bra off, unhook it and take it off in order to nurse if you're not using a nursing bra, okay, but not pulling it up over your breast. That can cause a problem. Other things that can cause compression on the breast and plug ducts is baby carriers. Okay, so you may be wearing your baby, which is great, and I'm a huge advocate of baby wearing. So I'm not telling you not to wear your baby, just think about it. If you're having recurrent plug ducts, it could be that the carrier is digging into a particular area of the breast consistently and causing plugs. Or if you tend to sleep on one side, like I know for me, I'm a left side sleeper, okay? I'm not just a side sleeper. I'm a left side sleeper. So I constantly sleep on my left side, and my arm's always getting numb because I'm always on the same side, but I'm also not lactating right now, so I'm not having an issue with breasts. But if you are breastfeeding and you are constantly sleeping on one side or favoring one side or not switching, you could be putting compression on that breast for hours. Think about it, okay? Anybody know, just from me saying that, anybody here can relate to what I just said as far as sleeping on your side, or had not thought of that you could be compressing the breast doing that, or doing that thing with your bra that I was talking about? Yeah, that's you. That's you, yeah. Okay, so, yeah. So Rachel said, yeah, and it's Rachel who I'm answering a question, that you had that happen. You switched to back wearing your baby. Okay, fantastic. Yeah, that was what I was going to say. Now, and even with back wearing, be careful because, sometimes you got the carriers and it clips here. There's a chest clip. Okay, so I'm just saying, watch what you're doing, pay attention, and be present and aware of what kind of compression is going on at the breast, because that may be what's causing it. Plug ducts can also happen from just ineffective removal of the milk. So it's not just compression. It could be that the way the baby's latching. It could be an oversupply that you have. So if you have an oversupply and milk is getting trapped because it's not being fully expressed, you may want to start to look at how to decrease your supply just to what your baby is eating. Okay, Rachel from Rachel's Remedy just said she can relate to that frustration of clogged ducts. That's what drove her to invent Rachel's Remedy. Okay, the best products out there. Okay, this has been my experience, and I've been involved not only in working with moms breastfeeding, but I've been involved in products for breastfeeding moms since Jade, who, I just told you, she's 15, since Jade was born, because Joe and I opened our retail store in 2002, 2 months after she was born. Okay, so that's what I was doing on my maternity leave. I was sitting with a newborn, and the limited internet that we had, okay, you guys don't know how lucky you are because it was very limited 15 years ago, searching for products to put my store together, connected to my midwifery OB practice, and that's actually where it was. It was connected to the practice, and researching all the products, fitting bras, pumps, and all the other things that I could not find in the regular big box stores. Okay, so Joe's going to get. Oh, this is great. Okay, so we have a picture.
Oh, perfect.
Look how perfect this is. Okay. So this is, okay, this was our original store. Oh, thank you, Joe. This was our original store, okay. We started with a very small store. It was really tiny. It was connected to my medical practice. There's Jade, whose birthday is today, and she's 15, in a carrier, okay? And this was how we started. And this is how I started becoming involved in baby products, in baby wearing, in breastfeeding. And there was so little out there compared to now that I remember we used to fill shelves with the same product, just spreading it out on the shelf because there wasn't much available, all right? But whatever was available, we made sure we had. Eventually, this little store grew into a 5,000 square foot retail store with everything, including classes, and that's how we actually went from there. And this is Jade now. This is actually Jade last year. There she is, Jade and Talia. Okay, these are my two girls right here. These are my loves, including my husband.
I think she watches, so if you're catching up on Mommy, happy birthday.
We
See
love
you
you.
tonight, sweetie.
We love you. Okay, so yeah, it's a great picture. Thank you for doing that. I forgot that was there. I forgot. It's not hung on the wall. We just moved into this house this year, so I got to get that up in our office so I can remember. Mm-hmm. Okay, so yeah, I think that just making sure that you're getting good feedings, and I also noticed that you said that the baby has some issues with seizures and on anti-seizure medications, and so you're not taking lecithin because of that. But for everyone else that is dealing with recurrent plugged ducts, lecithin is a, like sunflower lecithin, soy lecithin, is a supplement that you can take. What it does is some people just have more of a thickness to their milk. And that thickness can predispose you to have more clogs in the ducts, and the milk can get more trapped. So the lecithin tends to thin out the milk a little bit, and the studies and the research has shown that taking the lecithin can be very effective in preventing and treating recurrent plugged ducts and then further mastitis from there. So yeah, and then of course, Rachel's remedies, okay? These warm, moist packs. Again, let's talk about this for a second. So in relation to the plugged ducts and the mastitis, moist heat is different than just dry heat, okay? So heat in general is great for getting the blood vessels, all the vascularity around the ducts to dilate, which then helps with the letdown. It helps with the hormone reaction and the oxytocin release, which helps with the letdown. So this is all great, but the moist heat has a very special effect of actually penetrating the skin much easier. So the moisture, and if you've ever heard about, if you've talked to a lactation consultant, if you've read online, if you've ever heard me speak about moist heat, we talk about taking hot washcloths and putting them inside your bra or putting them on your breast. Two things about that. One, and this is why Rachel, of course, designed this, is that she was dealing with it herself. The moist heat from a washcloth will work. However, it doesn't stay warm very long. You know that, okay? You're talking about 30 seconds and the thing's cold again, and so you're trying to just keep heating it up. Not to mention the fact that if you try to put that moist compress inside your bra, you're going to be soaking wet. So this was really designed to alleviate both those issues, because the inner part here, okay, is something that can go into the microwave. All right, so this goes into the microwave, and I believe into the freezer too. Rachel can chime in here. So you can either make them cold or hot, but you put this into the microwave. And then once that gets microwaved, this sleeve that you're putting it into is actually waterproof, okay? And then the piece here is the part that you would moisten and make wet. That wet part goes right on top of here, and then that goes right inside your bra. So you've got the waterproof outside part, okay? And then the moist part here, and this should last, I think, about 20 to 30 minutes of staying warm and moist. So that's actually really, really good. And I'm reading here, let's see, yeah, Yeah, Rachel's saying yes, you can use hot or cold. Yeah, excellent. Okay, great. It's always so great to have the person who invented these products right here in the chat room. Thank you, Rachel, because you're the one who can answer these questions about it best. So I'm very appreciative that you're here to answer everybody's question. Let's move on to another question here, okay? Try to get through some more. Let's see. Leslie, okay? Leslie asked the question, I have a baby. Baby's 5 months old, exclusively breastfed. Good for you, Leslie. But at night, he will only sleep 3 hours at a time. I've tried cluster feeding, but he just gets angry and he doesn't get full right away, and he won't nurse if he's not hungry. He's pretty stubborn. Well, actually, I would actually redefine him, reframe that a little bit, okay? Your baby's not stubborn, your baby is smart, okay? Your baby is super smart, because who should eat when they're not hungry? And do we really want to teach them to eat when they're not hungry? All right, remember, these early weeks, these early months, these early parts of their life, the whole point of breastfeeding is to support the baby to understand their own hunger signals, to understand when they feel full and when they feel hungry, and to eat based on that. Now, how many of you know that that would be a good thing if we only ate when we were hungry and up until the point where we're not hungry, all right? That would help a lot of us. I know for me, I can eat beyond hunger for sure, all right? So we want that developed in their brain, and this is the time to do it. So forcing your baby to eat more, and this especially comes into play with bottle feeding, because you can, you see it in the bottle, whether it's breast milk or formula, and the research does show that babies that are bottle fed, regardless of whether it's breast milk or formula, have a higher and increased risk of obesity later in life, okay? So why is that? It has a lot to do with being overfed and not allowing that part of the baby's brain to develop to understand their own hunger signals and their own fullness, okay? And as you can see, Leslie, when a baby is feeding at the breast and they don't want anymore, it is literally impossible to get them to eat, okay? But that's a good thing. Your baby is not stubborn. Your baby is smart, okay? Babies at 5 months are not manipulating you, okay? I just want you to know that. Like, let's just say that right off the bat, okay? 5-month-olds, 4-month-olds, they don't manipulate. That comes later, okay? I promise you, that will come. That will come, and not that much later. But 5-month-old is not manipulating you. They are just doing what they're doing. If they're crying because they want you, it's because they really want you, okay? If they're crying because they're hungry, it's because they're really hungry. If they're crying because they're tired, it's because they're tired, or they need to be held, or they need to be comforted. They are not manipulating you, okay? And so giving in and following their cues is actually extremely important, especially at that age, because they're learning to trust their environment. They're learning to trust you. They're giving you signals of what they need, and they're looking for you to respond to that so they can trust the world around them, and especially you. You're their entire world. So I would say that the baby eating and only sleeping 3 hours at a time at 5 months, it's actually really normal. Okay, it's really normal. So I don't know, maybe you're comparing yourself to friends who maybe go longer stretches between feedings, who have babies that sleep through the night, and it does happen. Much of that has to do with breast capacity, okay? And I've talked about this quite a bit on other Q&As, other episodes, but we can talk about that for a minute. Most moms, okay, now I know there are people out there who have real milk supply issues, whether it has to do with a mechanical issue because of breast reduction surgeries, or it has to do with insufficient glandular tissue, or it has to do with a hormonal issue. There are reasons that some moms have real milk supply issues. That's a small percentage, okay, but it's real. When it happens, it's real, but it's a very small percentage. The majority of people who do have milk supply issues have milk supply issues because of inaccurate advice, early supplementation with formula, ineffective feedings because their babies are not latching properly to the breast, or they're stretching out their feedings and not feeding frequently enough, okay? But the majority of people can make enough milk to feed their baby. Maybe not pump all this extra milk or donate. Some can, but many can't. I was one of them. I could never do that. But I did make enough to exclusively breastfeed my babies, okay? Breastfeeding will depend on how much you can breastfeed and how often your baby needs to eat. It depends a lot on your breast capacity. That means how much milk can your breast hold at one time. Some people can hold a lot more milk in their breast, and their babies can eat more at a feeding and go much longer stretches, okay? Some people can hold less breast in their milk at a given time and can need to feed more frequently, but over a 24-hour period, they're still making enough to completely feed their baby. So your breast capacity has everything to do with how frequently your baby may need to eat. On top of that, breast milk is digested very quickly, okay? And so it passes through them fast, and you probably know that because they're pooping as you're feeding them, right? Breastfed babies poop a lot. It's because it's digested easily, that it passes through them, and so it doesn't sit heavily in their stomachs the same way that infant formula can. And so frequent feedings is actually a very healthy thing for a baby that age, and not something to put off. The good news is that even though it may be every 3 hours, as your baby ages, they become more efficient at their feedings. So even though they need to eat frequently because of breast capacity and the quick digestion of breast milk, the speed at which they can express the milk from the breast or extract the milk from the breast keeps on increasing and increasing, so that the feedings get shorter and shorter. How many of you guys notice that your feedings really got shorter over time, like a lot shorter, and even questioned yourself and wondered, is the baby even getting enough? Because the feedings are like 5-7 minutes and they're done. How many of you guys have noticed that? Because that's really, really common, and it's a common question, thinking they're not getting enough because they're only feeding for 5 minutes, or they only wanted one breast and they were done. These are all normal changes that the baby goes to, and it's actually something to look forward to. It's good stuff, and it gives you a perfect example of how inaccurate information or lack of good information about just the normal, most basic things when it comes to breastfeeding, okay, can lead you in the opposite, completely opposite, wrong direction, having you question everything about yourself, about your ability to feed your baby, about the health of your baby and whether they're getting enough. And then at the very worst, assume that you're not making enough because your baby's gotten so efficient, not feeding long enough, and you're supplementing, which then what does it do? It causes you to make less milk. So that very issue that you didn't have, you can create because of just not knowing this simple information. And this is why, I mean, I'm getting off, but the truth is here, this is why we're doing this Q&A. This is why I set up the lights and I set up the camera, and Joe sits here with me, and we go live with you guys several times a week to bring you this information, because look at these little simple things, and I can't tell you how many people don't understand this, is what could be causing so many issues, and not just issues, but the ultimate tragedy of someone not breastfeeding when they wanted to because they thought they weren't doing it right and not getting the right information from their doctor, their pediatrician, the nurses, or whoever is around them, okay? There's my soapbox. I don't care. I sit on the soapbox. So. Yeah, and let's give big hearts to the companies that support this great education, because there's just so many of them this year. Like, I'm going to be in tears talking about this because I'm actually really moved by the amazing people that I am working with, whether it's Rachel today, or it's Elise from Even Flow Feeding, or it's some of our new partners from Lalaboo and Love to Dream. You're going to meet all of them, Rumina, and there's just so many new ones. And the main theme from everybody has been, we not only want to make great products, but we want to teach. We want to bring this education to moms because they need it. The product's not enough. And it's everything I've been saying forever is that, and it's the whole reason we opened our store was because the product was not enough. It's what good is it if you don't know this? So we're going to do both, okay? We're going to give you great products, and the products are the tools. The products are the tools for what you already have, okay? So it's just going to make life easier, but ultimately you're the ones who are going to do this, and we're going to do it together with good information and knowledge. Yay! How great is that? Hearts, 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 hearts. I'm seeing all the hearts coming here. Yes, hearts, hearts, and I see that, Rachel. That was for you too. That was definitely for you. Okay. Let's move on. Today I'm very emotional. It's an emotional day. I keep thinking I can't help but keep thinking, where was I 15 years at this moment? Where was I at this moment? How many centimeters dilated was I? Where was I in my labor? Was I in transition yet? So I can't help. I'm just very emotional today, thinking about it all. So it's something you just don't forget. And the best part about it, as the years keep going on, all I remember is the joy. I don't remember the pain anymore. I don't remember the discomfort of it. If you had asked me back then, probably wouldn't be as joyful about the whole thing the day of. But 15 years later, that's all I remember. That is all I remember. So, okay. So if I can get through this whole live stream without tears, that would be good, right? I'm doing awesome. Thank you, sweetheart. Okay, so let's keep on going here. A couple more questions. Let's see. Tamara. Okay, this just went along with what we just answered here, but I'm going to answer it in a little bit more practical terms. Tamara asked, how do you know if you're producing enough milk or if you're feeding enough milk? Okay, now how many of you guys have watched my Simply Breastfeeding program? Okay, because I have an online breastfeeding class, okay, and it is 10 chapters, about an hour and a half, online streaming, day and night, okay. It's on my website, and it will give you all the information that you need to know so that you can go into your delivery, into the hospital or home, or whatever you're doing. Go into your mothering and your breastfeeding experience with good knowledge. Now, it's very basic, okay, very basic information, but it definitely will help you to understand the basics so that you're not like looking back going, oh crap, I wish I would have heard this before because it's exactly what happened to me. I can't tell you how many times I've heard that. So Tamara's question actually is like one whole chapter in my program about how do you know you're getting enough? And I want to like just give you some basic answers to that. The amount of milk that you're making is dependent on many things, okay? So first of all, if I said to Tamara, so say Tamara is exclusively breastfeeding at the breast, and I say to Tamara, your baby needs to eat about 2 to 3 ounces at a feeding, okay? So now go home and feed your baby 2 to 3 ounces, and she's doing this at the breast. Now, would that be helpful to Tamara? Because how could she possibly know how much she's feeding the baby? Right? She doesn't know how much is coming out. So that's not very helpful for Tamara to know, or for any of you guys, for me to tell you this is how much the baby needs to eat at a feeding, okay? The problem with that is that breast milk is different than formula in that it is constantly changing over time. It is changing throughout the day. It is changing depending on the weather, okay? If it's hot out, the water content is higher. If the baby is sick and dehydrated, the water content is higher. If the baby needs more fat, the fat content is higher. It is constantly changing. And so the quantity is a little bit irrelevant, okay? And it is also unmeasurable, okay? And I always say this, and I know it's a joke, but it's not, it's true, okay? If you were supposed to know how much your baby was actually eating in ounces, I promise you, through evolution, your body would have been born with a little gauge right here, okay? Full, empty. Full, 1 ounce, 2 ounce, Okay, it's ridiculous, okay? Think about it. I know it's a joke, but it's ridiculous. There's no gauge on your breast because you're not supposed to really know. That's not how you tell. The way you know that your baby got enough, very, very simple and kind of like duh, but it works. Before feeding, what I always recommend to moms is start by, are you guys laughing? Yeah, I know. It's ridiculous, right? But it's true. Start the feeding by getting in the habit of feeling your breast, okay, just as you're about to feed. This will do two things. One, it'll tell you about how full you feel. It'll also help to identify if there's any plugs that are just starting out. So if you feel any little lumps in the breast, you'll actually identify them. And the best time to clear those out before they get really bad is during that feeding. You latch the baby on and you can gently massage, okay, in a circular motion or downward towards the breast to try to clear out that clog. So get in the habit of, feeling the breast a little bit and feeling the fullness as well as any plugs. After you're done with the feeding, feel your breast again. If the breast feels emptier, and it will, and I promise you, if you pay attention to this, you'll understand what I'm saying. As the breast starts to feel emptier and your baby is has eaten, okay, and you're not soaking wet where it went into the baby, okay, it was there, now it's gone. It went in. That means milk went in, okay? So that's a really good number one indication that milk transferred into the baby. The second thing is you can hear your baby swallowing. And as you get good at this, you will see that you can really start to see what's a good feeding and what may not be a good feeding, because the time on the breast is telling you very little, actually not much of anything. We talked about that a minute ago, about how the baby gets more efficient with the feedings. So spending 5 minutes may give the baby a lot more milk than spending a half an hour where they're not really drinking much. Spending a half an hour on the breast just tells me they've been there for a half an hour. It doesn't tell me anything about how well the baby did or how much the baby ate, okay? So you're gonna listen for swallows, and as you get good, you're gonna almost know how much the baby ate just based on the swallowing. And a swallowing sounds like it's in the throat. Okay, it's not a breath. The baby's breathing through their nose, so you can hear them breathing. Okay, that's a breath. A swallow is a sound coming from the throat that sounds more like a, okay? That's a swallow, and that's milk transferring, okay? So that's the second sign that your baby got milk, is that your breast feels softer, you can hear the audible swallows. Third thing that you're going to look for is that the baby comes off the breast satisfied. And now that's a little tricky, okay, but like we answered whose question before, where they said, once the baby didn't want to eat anymore, the baby rejected the breast and fought her and didn't want anymore, probably the baby was full, okay? That's a satisfied baby. A baby that comes off and is sleepy and happy, that's a satisfied baby. And then third thing is a satisfied baby may not come off looking happy, but more food is not making them happy either, okay? And I'm not gonna go into depth with this because I'm about to announce our live stream for Saturday night, and you guys are gonna absolutely, don't miss this, okay? Like I'm telling you right now, do not miss Saturday night's live stream. It's, the topic is going to be calming your fussy baby, and what I'm going to go over with you is going to blow your mind, because some of these things are things that you need to know on how to help calm a baby without more milk. Okay, so it's going to help you with that, and it's like what I wish I had with Talia, right? Our second. I literally wanted to have another baby when I learned all this stuff, just for the fact of I wanted to do it myself, because we didn't get to do that with Talia. Okay, so don't miss Saturday night's live stream with Love to Dream. It's gonna be so great. Okay, so that's Saturday, and I'm gonna wait for that information. So that's the third thing. Baby is satisfied, and I'll show you how. And then the fourth thing, and this is the most important thing, and this one is the one that is going to actually give you something to measure, because I know we need something to measure. Okay, we need something measurable to know, is it enough? Okay, how many wet diapers? Simple. Okay, wet diapers is going to tell you that your baby got enough. 6 to 8 in 24 hours is the right amount to know that your baby is not dehydrated. And I can't tell you how many times I get emails from moms, messages from moms, calls from moms saying, my baby looks hungry. I don't think I'm making enough. I'm exclusively breastfeeding, but I can't tell how much I'm making. And I think that it's not enough. And then the first question, the very first question I'll always ask is, how many wet diapers? And, oh, well, so many I can't count. All right, right off the bat, we know it is not a supply issue. It cannot be a supply issue. If that much is coming out, that much is going in. Now, could the baby have other issues? Could it be something in your diet? Could it be an oversupply that's actually causing some of this? Lots of things could be happening, but is the baby getting enough? Yes. Yes. Okay. So those are the 4 things to know that your baby got enough. Tamara, I hope that answers your question in a lot of detail. Okay. A lot of detail. And notice that I gave you all the tools you need without ever saying how much your baby needs to eat, because that depends on you. How much your baby needs to eat is how much your baby needs of your milk. Your milk is different than my milk, than her milk, than our milk, okay? Everybody has different milk. And so how much your baby needs in the morning is different than at night, is different than tomorrow, okay? And that actually doesn't change much over time for you. That's another thing too, is that as the baby gets older, that quantity of milk really doesn't change much. We've also talked about that quite a bit, which we will cover on another broadcast again. Can you tell that there's a lot of information that I need to give you? Can you tell that we can go on and on forever going over all these different things? And I do repeat myself for some of you guys who watch frequently, and I love that you're here because I can see all the support that you're offering here in the chat room, and I expect that. Okay, I expect anybody who took my classes, who then, because they took my classes, they're part of our private Facebook group, okay, which I love you guys. Watching you're supporting each other, oh my God, amazing. Like literally I'm in tears watching you guys give each other amazing support. And for all of you guys who are new here, you know, take a class. If it's not my class, take a class, or show up for these live streams and ask your question, post your question. I may not get to every question every time, but I'm sure there is something that I'll offer you that you didn't even think to ask and will help you anyway, okay? Did everybody learn something today? Did everybody learn something today? I want to know, and let's get some hearts for that if you learned something today that you didn't know. You know, even if you're experienced breastfeeding mom, because I know when I do some reading or I, you know, read research, I'm always learning something. And I am always amazed and mystified and just so excited to hear how wonderful our bodies are. Like really, how wonderful our bodies are and how well they're equipped to take care of our children. So yeah, Rachel so wish that she knew this, that she knew about me. I wish I knew about me when I had my babies, okay? Isn't that the most ridiculous thing? Yeah, everybody says that to me. What?
Read Brooks' comment.
Brooks' comment? Where? I can't see it.
Pumping weight now to increase letdowns, just knowing your support.
Awesome. Awesome. Yeah. And you know what? Pumping, I want to say too, so let's just get back to Rachel's Remedy here because for a minute, because somebody's going to win Rachel's Remedy and it comes with 2, of course, okay, because we wouldn't want you to not have 2. So the package comes with 2 included, all right? And so you're going to get both of them inside the package. And I just want to say that we talked about it for breastfeeding, but this is also fantastic for pumping, okay? Because like we said earlier, it does help to, helps the blood flow, it helps the letdown, and that can actually be a real issue when it comes to pumping you. And it also helps the oxytocin release, which is a huge issue. Sorry, my nose is, my nose. We're all friends here, right? And can be a huge issue, especially when you're trying to let down to a machine. Okay, so it's fantastic for pumping moms, it's fantastic for breastfeeding moms, and especially if you're struggling with any of the issues that we talked about today. Okay, so I want you to give lots of love to Rachel's Remedy. You can go over, you can click over, it's on the post here. You can click over and go give her love on her Facebook page, follow her, and then also right here in the comments, tell us why you want it. Tell us if you want it. Tell us what you do with it, okay? And just lots of love to Rachel and to everybody who makes this possible, okay? I had a wonderful time with you, and tonight I get to spend time with my children and my husband, and we're gonna have an amazing birthday dinner, and yeah, we're very excited. So please make sure you look forward to my post later on today. I'll be announcing our Saturday night live stream, Calming Your Fussy Baby. Super excited. And post here, love this post, love at the top, love it, and then comment, and then we will be picking a winner in the next couple days, okay? Thank you so much for joining me this afternoon. It's a dreary day here, but you guys brighten everything up, okay? I love you, and I'll see you on Saturday. Have a good week. Mwah. Bye, everybody.